welcome, a very warm welcome to our fourth monthly C3 talk for CornWELL festivals that we've held this month. And a few words from me. First of all, CornWELL is a cross-sector, cross-discipline network whose purpose is to improve well-being through conversations and connections. And we're for patients and sufferers, as well as supporters and service providers. Sorry, just multitasking here a little bit. So that's what CornWELL is. Our mission is to improve well-being through conversations and connections. Our vision is that more people in Cornwall should be healthy than are unhealthy. And unbelievably and disappointingly, this is currently not the case yet. But I do think it is something we can achieve. We have the collective wisdom, communities are good at it. People know how to look after themselves and each other. We have sort of innate knowledge about how to do this. And I believe, and the philosophy with CornWELL festivals is that connections and conversations are at the heart of what we can do, what we know how to do, and what can be really conducive of good well-being. So that's why we're here, to bring that vision about. And we do that in three ways. First of all, by having events, and in particular festivals. And festivals are important because they're multi-sensory, they're multimodal, they're not just talking, they're not just didactic flow of information, they are actually inclusive. People can get involved, not just experts, but people that are experts in their own lives, members of the public, and various different cultural, artistic, musical, interdisciplinary, creative methods are really important in the maintenance and creation of health and well-being. So that's the first thing we do, is events. Secondly, we increasingly are doing network analysis to see actually where are the gaps, where are the clusters of good connection, because it's not just the components of the system that are important, it's the connections between them that really make a difference. And I think we all know that intuitively, and I hear it mentioned quite a lot, but the more we can see where silos are or where good areas of good connection are, the more we can drive those good connections. And there is a science of that, it's called network analysis. So the more we do of that, the better we're going to get at this whole game. And thirdly, we increasingly want to do local interventions and actually do some things in particular places that actually make a difference that we can measure on people's health and well-being. This whole thing is a holistic and inclusive and a growing area. You might hear it referred to as lifestyle medicine, as health creation. You might hear the words community power, population health. And these concepts are what Sally Turner, our speaker and our convener of this wonderful session today, has been doing for a while, is doing live in Perranporth. Sally's been the chair of the Citizens Advisory Panel for NHS Kernow for a number of years. The job there is to give voice and to listen amongst us all. And increasingly, Sally is active at a local community level and building things from a community up as well. And I really wanted us to hear why that's so important, how it's working, what's going on. And I'm certainly planning on copying or borrowing or taking or sharing some of those ideas and doing them locally in Newquay. Personally, that's where I live. But I thought all of us could really benefit from hearing and talking about some of Sally's ideas. So without any further ado, I will hand over to you, Sally. Thank you very much for joining us today. Really looking forward to this whole session, and I'll help you manage it as we go. Over to you. Thank you very much.
Thank you. Thank you very much, Adam.